Nattokinase is an enzyme present in natto, a traditional fermented Japanese food. It may help to dissolve blood clots, which gives it a therapeutic potential in heart disease. Natto was found to dissolve artificial fibrin, an insoluble protein involved in the formation of a blood clot. It has the highest anti-clotting or fibrinolytic activity compared to other enzymes, making it a promising avenue for research in patients with heart disease. Another advantage is that it can be either consumed as a dietary supplement or orally administered. Nattokinase has been extensively studied in Japan, Korea, and China. However, only recently has the enzyme been recognized for its powerful clot-dissolving properties in Western medicine. Despite its name, nattokinase is not a kinase enzyme, but instead it belongs to a serine protease family of enzymes. It works to break down other proteins. The mechanism of action studied in the animals and human cells are many. It directly dissolves cross-linked fibrin, a protein that forms blood clots. It increases the release of tissue plasminogen activator from the cells, which breaks down fibrin. It increases urokinase levels by converting internal pro-urokinase to urokinase. The increased urokinase activity leads to increased plasmin in the blood, and the plasmin is responsible for degrading fibrin. It inactivates plasminogen activator inhibitor 1, and this degrades fibrin. And it inhibits platelet aggregation by blocking thromboxane, which is a substance released from the platelets that causes blood clotting and blood vessel constriction formation. In 2 clinical trials, one with 79 and the other with 86 subjects with high blood pressure, the group that received the dose of nattokinase once a day for 8 weeks had reduced blood pressure, systolic and diastolic, compared to a placebo group. One of the studies found the reduction in blood pressure was more significant in male subjects. The nattokinase inhibits the angiotensin converting enzyme, which causes a narrowing of the blood vessels. Inhibiting this enzyme may be involved in reducing blood pressure. Nattokinase has the potential to benefit patients with thrombosis, which is formation of a blood clot inside a blood vessel. In a clinical trial, 45 subjects were divided into 3 groups, and they received nattokinase daily for 2 months. A healthy group, patients considered at risk of heart disease, and patients who were undergoing dialysis. Risk factors for heart disease were significantly decreased in all the groups. In a study of 12 healthy adult males, a single dose of nattokinase degraded the fibrin, and it decreased the levels of coagulation factors which are involved in blood clotting. Its effects lasted for a long time, over 8 hours, compared to other enzymes. In rats, its clot-dissolving activity was stronger than that of plasmin or elastase. In rats with thrombosis, the nattokinase decreased blood clots better than the saltwater solution. In addition, a high dose of nattokinase was as effective in reducing the blood clots as a known anti-clotting agent. In rats, a high dose of nattokinase fully inhibited thrombus formation. This was similar to the effects of aspirin, a well-known blood thinner. Nevertheless, the lack of adverse effects associated with its consumption suggests that it could be an effective treatment for improving blood flow. Blood clots were experimentally induced in dogs, and the oral consumption of nattokinase dissolved the blood clots and it restored normal blood flow in only 5 hours. Nattokinase directly reduces fibrin clots 6 times more efficiently than plasmin. It increases the activity of anti-clotting enzymes, and it reduces pro-clotting enzymes. A study comparing nattokinase with statins, or cholesterol-lowering drugs, randomly divided 82 patients into one of 2 treatment groups for 26 weeks. Both treatments reduced the total cholesterol, the LDL, bad cholesterol, and the triglycerides. However, only the nattokinase consumption increased the HDL, or the good cholesterol. Other studies do not report a significant reduction in cholesterol levels. Daily nattokinase supplementation was remarkably better at reducing plaque size that causes the hardening of the arteries or atherosclerosis compared to statin treatment in 82 patients. The mechanism by which it reduces the cholesterol levels and decreases the plaque size that results in the prevention of the artery hardening may be different from each other. High VWF is a mediator released by damaged blood vessels and increases the risk of forming a clot. When the levels are increased, it's associated with a greater risk of having a stroke. In a study of 79 hypertensive patients, the VWF was reduced by 15% in the group that took the nattokinase. Certain factors that are high in Alzheimer's decreased with the oral nattokinase consumption, like acetylcholinesterase, TGFB, FAS and interleukin-6. Meanwhile, others that are usually low increased with the nattokinase treatment, like brain-derived neurotrophic factor and insulin growth factor 1, compared to the untreated rats with Alzheimer's disease. Thus, the nattokinase may be potential therapy for the treatment of Alzheimer's. In cells, it also degraded amyloid fibrils, which are the protein aggregates commonly found in cases of Alzheimer's disease. In cells, nattokinase efficiently degraded parts of the gliadin, a component of gluten, hence it may be a potential new treatment for intolerance of gliadin known as celiac disease. Nattokinase activity is measured in fibrinolytic units. Based on human studies, 2,000 fibrinolytic units has produced the greatest cardiovascular and anti-thrombotic benefits. A combination of nattokinase and red yeast rice reduced cholesterol more efficiently than nattokinase alone. In clinical trials, 47 subjects with high cholesterol levels or hyperlipidemia received either nattokinase only or nattokinase and red yeast rice, or a placebo for 6 months. The treatment with the nattokinase only started to decrease the blood cholesterol and triglyceride levels in the last month of the study. However, the combined therapy with nattokinase and red yeast rice reduced the levels of LDL, total cholesterol and triglycerides, and it increased the HDL from the first month onwards. Taking nattokinase with red yeast rice can also reduce uric acid, and thus it may be helpful in reducing inflammation, gout and kidney stones. A byproduct of the bacteria Streptomyces omiensis may enhance the effectiveness of nattokinase. Nattokinase is considered generally safe to consume as a food. This is based on a lack of reported side effects from human clinical trials, and the fact that it's been part of the Japanese diet for thousands of years. Nattokinase binds to heparin, a glycosaminoglycan, which is used as an anticoagulant drug. Depending on the length of the heparin chain, the nattokinase can interfere with the heparin's function. It can also bind to other glucosaminoglycans. Since nattokinase may cause blood thinning, it should not be paired with other blood thinning agents like aspirin or warfarin. This could increase the risk of a brain hemorrhage in patients who have small vessel disease. There's also a risk of clotting mechanical heart valves if the nattokinase is substituted for warfarin. For more information on herbs, supplements and health conditions, check out my website. There's also a video on serrapeptase, another powerful enzyme to help with blood clots. Or for more detail on clotting, there's a video on pulmonary hypertension.